Hi, I'm Dr. Patel, and today we're going to talk about 5 common mistakes you make while brushing your teeth. First and foremost, I want you to like, subscribe, and hit the notification bell. That way you can keep following me for more content like this. So the first mistake that I commonly see is that patients are using their toothbrushes too long. How long is a good toothbrush going to last you? We see that most toothbrushes are meant to be used about 200 times, so about 3 months is what I normally recommend to patients. Also, after we get sick and things like that, we don't want those bacteria, they live on the toothbrush, and we don't want them to continue living there, especially because we've been sick. It's hard for us to get better if we're constantly introducing them to our mouth. So the second thing I want to talk about is not brushing long enough. We really want to make sure we are brushing for about 2 minutes. Most people have gotten into the habit of brushing and things like that, so they just go through the motions and aren't really focusing on making sure they're brushing every single area and every single tooth the way it's supposed to be. Using a timer and things like that might help, but the cool thing nowadays is we have electronic toothbrushes with timers built into them. Most of them will buzz or give you some kind of feedback to when it's been 2 minutes. Getting a tool that works for you is really helpful. Number 3 is making sure that we're brushing in the proper motions that need to be. So what I mean by that is we're always taught to brush side to side, but you really want to make small circular circles on your teeth and make sure you're getting them nice and clean. But you also want to make sure that you're angling the toothbrush towards the gums a little bit. That way the gums can clean inside the sulcus or the little gap that sits between your tooth and your gums. So for the fourth thing, I want to talk about what kind of toothbrush should you be using. Hard toothbrushes can be a little too abrasive on our teeth. It can actually do more damage than good. Some patients I find come in and they're like, I only like the hard toothbrushes. The issue with that is that rubbing the teeth in a way that it's not supposed to be, and so we can do more damage. We can also hurt the gums a little bit with a hard bristle toothbrush. So what we normally as a dentist recommend is something soft bristle toothbrush. It's gentle, gets the teeth clean, and does the job the way it needs to be done. And for number 5, this is a very common one, and most people know that they're doing it and they still just don't have enough time for flossing. But flossing really is a good routine to get into. Make sure that our gums are healthy, there's no inflammation, the plaque and bacteria that's living deep underneath in the crevices of our gums, we clean those out. So making sure we're flossing. There are a lot of things that are out there that will help us with flossing, like water picks and things like that. Sometimes the traditional is best, and so I would recommend that we at least floss once a day if we can, and just make sure we keep our teeth and mouth clean. So guys, those are my 5 common mistakes that I see as a dentist with people and their brushing techniques and routine. Make sure to like, subscribe, and hit the notification bell. That way I continue to get you cool tips and tricks.